A 65-year-old man. Oh, sorry. Which of the following is the most likely cause of this patient's dyspnea? Atelectasis, bronchial obstruction, pleural effusion, pneumonia, and pulmonary embolism. 65-year-old man with a history of congestive heart failure presents to the clinic with complaints of increasing dyspnea on exertion for the past 3 weeks. On physical exam, the patient has bilateral lower extremity pitting edema, and his breath sounds are decreased at the left lung base. A chest X-ray reveals an opacity in the left costophrenic angle with a blunting of the angle. Okay, so he's got this past medical history of congestive heart failure and now has increasing difficulty breathing. Um, so he's got the bilateral lower extremity pitting edema, which fits with the CHF. And then he can't breathe at the left base. Okay, this is a very typical finding of one of them. Um, um, blunting of the angle. I know I've seen this before. Um, honestly, there's two things it kind of fits. I'm gonna go with atelectasis can happen with so many different things and it can be so vague.
So
So
remember,
what if
putting the whole clinical picture together, right? The risk factors,
yeah. The,
history.
he's got too much fluid is his problem in general.
Okay,
Uh,
good.
that's kind of like what I'm thinking about in my head as I'm trying to put this all together. So that kind of the idea of too much fluid kind of gets me down to the idea of a pleural effusion versus atelectasis, because atelectasis can be caused by so many different things. Um, that opacity, honestly, I think it fits with pleural effusion. He's got the opacity. I think I'm gonna stick with that. I could be wrong, but we'll go with
No,
it.
pleural effusion is correct, right? Because
Okay.
remember, if you talk about kind of congestive heart failure, right, going back to kind of this heart diagram that I always draw, right? And
Yeah.
so if you have, here's your left ventricle, right? If you have kind of left-sided heart failure, fluid is going to back up into the lungs, right? And then when you have fluid back up, it's going to pull kind of the bases, right? And that's where you're going to get pleural effusion. So atelectasis is a little bit different, right? If you remember, right, atelectasis is caused by, a bunch of things, right? But usually decreased pressure on dullness percussion, but not really kind of this bilateral lower extremity edema and kind of pulmonary edema. Atelectasis is different. So when you're dealing with congestive heart failure, you should always be thinking of pleural effusion. That's why people feel like they're drowning, right? And
Because
they
they
need
are.
yeah, because they literally are, right? Their serum is getting backed up into kind of the lungs, and that's why they can't lie down flat, right? People with congestive heart failure, they can't lie down flat at night because instead of pulling, if you think about, let me see if I can draw this. So if you're standing up, upright, then it pulls only on the lower, right? Because of gravity dependent. But if you lie down, right? If you imagine your lungs are lying down like there, it's going to pull like this. You know what I'm trying to say? So then you
Hmm.
have less amount of alveoli that can actually go through kind of your oxygen exchange. And so these patients like to be propped up and kind of slept on an angle so that it doesn't occlude a lot of their alveoli. So yeah, that's kind of how you think of it. That's why you're literally drowning, right, when you have congestive heart disease. So